Hi guys, I'm Nina, and I'm going to be presenting on Chlamydia trachomatis. This is a sexually transmitted disease. And first, I want to talk a little bit about the organism, and then we'll talk about the disease. And then I kind of have this set up in a little bit of like a Mythbusters kind of fashion. So I have found some really common myths about the disease, and we're going to use like science, facts about the organism itself to show how those are false. So first, the organism, it's a gram-negative organism. It's anaerobic. It's an intracellular obligate, so it needs a cell to replicate and to infect. And this cell happens to be a eukaryotic cell, so you can see how it is very contagious to humans. The disease itself, often if you have it, you're asymptomatic, which is a big problem, and probably from like logic, it's probably why it spread so much and so quickly, because you can be asymptomatic for weeks before symptoms start to show. And 70% of women who have this disease also have mild cervicitis. So basically what this is, you have vaginal discharge often, bleeding, abdominal pain, and dysuria. Dysuria is just like discomfort when urinating. And as you can see in my image to the left, you have the uterus. The cervix is part of the uterus, but it's like the lower part closer to the outside. And you can see a normal cervix, it's very pink, flesh-like, healthy tissue. But when you have cervicitis, it's inflamed, it's red, there's a lot of swelling, and then you can see the discharge, it's yellow in this picture. And so that is like a common symptom, but since it's mild, some women might not even realize, which is another problem. Another common symptom of chlamydia is pelvic inflammatory disease. And then urethritis. This is more common in men than women, but women can also have it. And like symptoms look like urethral discharge or dysuria as well. For women, symptoms are more similar to a UTI. So maybe like pain when urinating, like stinging, maybe a bad smell as well. Um, Another less common, but I thought it was super interesting symptom is reactive arthritis. And from my research, only 1% of men who have chlamydia infection also have reactive arthritis. But I thought it was really interesting how they made that correlation that it could be a result of the infection. So moving on to our little like Mythbusters section, these are just some ones that I found that were interesting and that maybe other people also had like preconceived notions of that we can help sort out. So chlamydia only affects females. You can tell if you have chlamydia. Chlamydia is difficult to treat. You can catch chlamydia from a toilet seat, and oral contraception can protect against chlamydia. So the first one that we're going to do is that chlamydia only affects females. That is not true. It can affect both male and female. So we'll start with anatomy, just like the way the male and female bodies are set up. So as we learned, the male urethra is a physical barrier to infection. So it makes them less likely to contract the disease because, as we'll talk about later, chlamydia is spread from direct contact with infected tissue. Another thing that makes women more susceptible than men and why that could be a preconceived myth is that women may have cervical ectopy, especially when they're in their teenage years. So because of the high levels of estrogen. So as you can see here in the images, a normal cervix, very healthy looking tissue. And then you can see small ectopy, that red, those are the endocervix cells that are kind of coming out to the ectocervix. So endo is kind of like a prefix meaning in, and then ecto is out. So normally you want those red looking cells, and it is inflamed, so it looks more red, to be inside your body, inside the cervix. But with the ectopy, they come out, and those happen to be the cells that chlamydia is more susceptible to infecting or infects easier. Those are, I believe it's squamous columnar cells. And because of that, I found this fact from the CDC, 1 in 20 sexually active young women aged 14 to 24 years old have chlamydia. And that is like pretty rampant. So that is why males and females can both contract chlamydia. Another myth is that you can tell if you have chlamydia. As we discussed earlier, you're often asymptomatic if you have this disease, which again makes it difficult, especially if someone has multiple sex partners. They're going to be able to deliver the disease to other people quickly, and like it's from tissue to tissue, so it's very highly contagious. The incubation period is unknown. And remember, that's the time that you don't have symptoms, that is just like kind of brewing in your body. But we do know that chlamydia has a slow replication cycle. And symptoms may not appear until several weeks after exposure, which we'll talk a little bit about later, but that can be detrimental to a woman, especially because it can lead to infertility. And from what I've found in my research, 10% of men and 5 to 30% of women with confirmed infection are symptomatic. So that's a very low percent out of everyone who's infected. And again, that 1 in 20 women can have it. Okay, the next myth is that chlamydia is difficult to treat. This is not true if you catch it soon, but that's hard because a lot of people are asymptomatic. So when it's treated promptly, and the common, I guess, order or procedure for what doctors usually prescribe is azithromycin, and it's an antibiotic. So when it's not treated promptly, it can cause infertility. And if you can see in the diagram, which we'll look closer later in like just a second, you can see that the chlamydia, as it's growing and replicating in those cells, it can move up the uterus, and it can even move into the fallopian tubes. And as you saw, it's causing swelling, it's causing a bunch of lymphocytes and leukocytes to come to that site. And this can damage the organs that are very sensitive in the woman's reproductive tract. And again, pelvic inflammatory disease from that swelling can occur. And so, yeah, as you can see in my little diagram, we have the leukocytes on the left, and then you can see how they're attacking the chlamydia on the right, when it is on the endometrius or even up into the fallopian tubes. Okay, the next one is that you can catch chlamydia from a toilet seat. So this one's kind of silly, but people think that this is true, and that is not true. Yes, it is skin to skin contact, or tissue to tissue contact, but like I said earlier, the certain cells can host the chlamydia organism. So chlamydia is taken up by host cells as an elementary body, and we'll look at this image here and see those elementary bodies in a second. But the target cell is a squamocolumnar epithelial cell. And if we break that down, squamous tissue is often for like filtration, secretion, and diffusion. And then columnar tissue is often for used for like protection, and I believe some secretion as well. So when the organism infects that tissue, it's an area that is like used to having things coming out of it and like secreting and in, that it's easily taken up by chlamydia is easily taken up into those cells. So once it's the elementary body that's in the host cell, then it's able to differentiate into a metabolically active reticulate body. Because before, while it's still the elementary body, it's not metabolically active, but that's how it's kind of like triggered, if you will. And again, this happens through direct contact with tissue. Males, it's more the urethra, but for females, it can be the endocervix, in the upper genital tract. But as we talked about before with cervical ectopy, that endocervix comes out to the ectocervix, so you have that one less physical barrier of protection. So here's a little bit closer up on that smear. I believe this is a pap smear, but you can see how the elementary bodies are in the host cells. You can see they have like a little nucleus there. And the red is kind of indicating them. And so then they'll start differentiating into the reticulate bodies that are gonna start just like mass producing. Okay, then the last one is that oral contraception can protect against chlamydia. No, that is not true. And actually, oral contraception will make you sometimes more susceptible to it. So, since chlamydia is spread through that skin to skin direct contact, oral contraception can help you with that. And it can lead to cervical ectopy because of the high estrogen levels that certain oral contraceptions put in your body. And this ectopy, as we talked about, makes you more susceptible to the disease. And the most effective prevention is to have a single sexual intercourse partner. That's like the most like 199% effective way. The infected mothers can pass chlamydia to their children during birth. And this is really sad actually to see too, because the two main, I guess, symptoms or diseases that can come from that onto your your baby would be pneumonia, and that's just so sad for a baby. And then conjunctivitis. So it's actually called ophthalmia neonatorum, but basically it's pink eye is the just generic name for it. And it most of the time will not cause any vision deficiencies, but it can, in rare cases, cause scarring of the conjunctiva, which then would lead to more severe vision disabilities. But it is treatable. But when you are in such a vulnerable state, just out of the womb, like any infection is not going to be ideal to any extent. But yes, so that is my presentation. Here are my sources. Thank you for listening. And if you have any questions, I'm excited to answer them later. Bye.